My medical training and education goes back quite far in time. After finishing, I'm originally from Ukraine, I'm Ukrainian. I finished my primary and secondary school, then I went to a medical college, which gave me some medical education prior to getting to the state university, state medical Ukrainian university in Kyiv, in the capital of Ukraine. I got the place there in 1988 and I studied there for over 5 years. By that time, my family, my parents and brother immigrated to Australia, and there was really a question to what to do next, and I joined them in 1994. Coming to Australia, it took time for me to get better with English and to undergo quite a number of the other courses, as a desire of mine to get back to medicine was really high, and that was my priority. On the way back to medicine, I did various courses. Initially, I got to the University of Technology in Sydney and did a year of nursing, and that was my first year at the Australian university educational system. I finished that year very well and again applied to various medical courses and science courses, and the biomedical science course at University of Technology gave me place. It was another step forward towards getting to medicine. So I stopped the nursing studies and got to biomedical science, and again at the end of the year I got top marks. And at the same time I was going through various applications to medical schools in Australia, and in Tasmanian Medical School within 3 years I was coming every year for an interview and just improved my chances every time. And after my third year of life in Australia, after finishing well biomedical science, I was blessed with the entry ticket to Tasmanian Medical School. I entered to year 4 of the 6-year course because some of my previous studies have been credited. So I finished 3 years at the Tasmanian University Medical School, and I finished with the honors degree. And then my internship was at the Royal Hobart Hospital, and then 3 more years I worked there as a resident and then a registrar in general surgery and plastic surgery. And finally, after my applications, I got to the training in general surgery and then moved to Melbourne, end of 2003. 2 years of general surgery in various hospitals in Victoria was a fantastic experience. And then again, my further application was successful to cardiothoracic surgery. And since that time, starting from 2006, with my first job at the Monash Medical Center, I continued my training. And then 5 more years, it's a long road, 5 more years in cardiothoracic surgery. And after finishing the course, I had to I made myself to do 3 more years of various experiences, fellowship. I wanted to shape myself as an accomplished cardiothoracic surgeon to make sure there is no weakness in my knowledge of skill before I started practicing on my own. 1.5 years of training, fellowship, or working as a young surgeon at St. Vincent's Hospital in Melbourne, predominantly doing thoracic and minimally invasive thoracic or chest surgery, operating on the lungs and chest walls and chest masses. Then another 6 months I worked at the Alfred Hospital, and that was experience and exposure to transplantation surgery of the heart and lungs and mechanical ventricular assist devices. It was a fantastic experience, I must say, and that's what I really like doing. I have done about a dozen of lung transplantations and participated in heart transplantations as well. And then the last 6 months I spent at Royal Children's Hospital, which was again great experience, operating on very little children in fantastic international team of the surgeons. And after this 1.5 years, I moved to overseas to do another about half a year in England, in the Bristol Royal Infirmary, where it was cardiac surgery predominantly, and another year in Canada, Toronto General Hospital, working in a cardiovascular and transplantation unit, and that was great experience. The size of the unit, the diversity of the operations, exposure to a lot to the valve surgery, to mitral valve, the aortic valve, and aortic surgery, as well as heart transplantation, was a really great experience. So after finishing my official training, 3 more years of shaping up myself as a surgeon, getting more knowledge and skills, getting more passion, understanding better what a surgeon can and what surgeon should not do. And then I came back to Australia, and that's where my path as a cardiothoracic or heart and lung consultant surgeon started. That was my slightly extended answer to what my education is. In a nutshell, to get 1 degree of a doctor, it took for me 10 years because of doing it in 2 countries and doing a few courses on the way. So I knew exactly what I was heading towards and persisted. And again, with the God's help, it all worked really well for me. What I got more in terms of my experience and skills, each place brought something new. I always found what else can be done, how differently it can be done. For example, at Bristol Royal Infirmary in UK, the unit was specializing in doing the bypass grafts on the beating heart of pump surgery. There are serious messages that I took on board, and at times you really try to learn what to do, at times what not to do, and that was my experience there. And I worked with the surgeon who did the mitral valve and minimally invasive mitral valve surgery. That was a great experience. Then moving to Canada, a very different level of a healthcare system. We worked in major, very big center, Toronto General Hospital. That was combination both of doing the cardiac surgery involved in transplantation experience and working in intensive care unit. The way Northern American system works is that the fellows, they work both in operating theaters and on the ward and in intensive care unit, which was a refresher for me. And that was a major exposure to the mitral valve surgery, to repair, replacement, a lot of the valve, aortic valve and ascending aortic work. That was a unit of the size that would be larger than pretty much any unit in Australia. And this type of experiences you never forget. And then coming back and starting working in Australia, initially in Townsville Hospital, where it was a very different environment. I was involved in a lot of surgery on Aboriginal people with rheumatic heart disease, with people who may have not been experienced to the good standards of the healthcare, who, let's say, didn't look after them well. And that's another extra experience to how to get the adequate and the best centered care to the patients. I worked for a short period of time in Gold Coast University Hospital, and then returned back to Victoria, to Melbourne, and again work for sometimes as a locum at the Alfred Hospital, which I absolutely love, the team there and the work that they do, at the Monash Medical Center and in Geelong Hospital. And then after returning back to Melbourne, I started developing my own private practice. So that was my journey, and new things from every place. I would pick up something new and incorporate in my practice.